Assalamu alaikum and welcome to the Dr. UOT channel. In this video, we will talk about the cardiac cycle and cardiac events. Well, this lecture is available in Urdu, so now we'll proceed the lecture in English. Cardiac cycle and cardiac events. What is cardiac cycle? We define cardiac cycle as it is a period of time that begins with the contraction of atria and ends with the ventricular relaxation. This period of time is called as cardiac cycle. So what is this period of time? That is 0.8 second. And now what is the starting and the ending point for this cardiac cycle? The cardiac cycle starts from the atrial contraction and it ends with the ventricular relaxation. You can observe this through the ECG. If you remember our past lectures in which we studied that the cardiac cycle starts from the atrial contraction, that is representing the P wave, and the QRS complex, which represents the ventricular contraction, and the T wave, which represents the ventricular relaxation. So this ECG is actually this from P to T is actually the cardiac cycle. And a cycle obviously means repetitive way of any action. So this actually repeats after T wave, again the cycle repeats. So this is actually called as the cardiac cycle. Now what is cardiac event, or what are the cardiac events? Events are actually the steps to complete the cycle. Now what are the steps? These steps, that atrial contraction, ventricular relaxation, these are actually the steps in which this cardiac cycle is completed. If more precisely we define the truth, what are the steps or what are the cardiac events? So we will tell that cardiac events are actually the atrial ventricular events. We have two types of events, and they are further divided into atrial relaxation, atrial contraction, ventricular relaxation, ventricular contraction. Atrial relaxation takes for about 0.7 second, and atrial contraction takes for about 0.1 second, and ventricular contraction takes for about 0.5 second, 0.3, whereas ventricular relaxation takes for about 0.5 second. When you sum up them together, what we see is that ventricular contraction takes 0.1 and relaxation 0.7. As a whole, a ventricle contracts and relaxes within 0.8 second. And again, the ventricular contraction happen 0.3 to 0.5 within 0.8 seconds. So you can say that atrial contraction take time of now these are the atrial, both atria. Okay, both of them, they consume the time of 0.8 seconds. And the same is the case with the ventricles. They also consume 0.8. And the division is different for the contraction and relaxation. That is obvious and in front of us. We can understand. To the point, that is the physiological terms of the events. That is systole and diastole. For the systole, we use contraction. For the diastole, we use relaxation. Means these terms are used. For the contraction, systole is used. For the relaxation, diastole is used. So if both of the atria and the ventricles, they are going through the process of the contraction and relaxation, but physiologically and in clinical terms, the systole and diastole, these terms are specific for the ventricular contraction and for the ventricular relaxation. Means if the ventricles contract and pump the blood out, that is called as systole, and when the ventricles relax and are filled with the blood, then this is called as diastole. So clinically, systole is the ventricular contraction and diastole is the ventricular relaxation. So in short, we say that in clinical terms, we focus and we specific the term systole and diastole for the ventricles. Now coming to the events step by step, how these events occur. First of all, what will happen? According to the ECG, the atria are supposed to contract, then the ventricles will contract, then the ventricles will relax, and the cycle will complete. So how physiologically this happens? First of all, the passive flow will occur. According to the passive flow, we know that the atria are filled with the blood and they are receiving, specifically if we talk about the right atria, it receives a regular inflow from the inferior and superior vena cava to the chamber. And in the meanwhile, we know that before the atrial contraction, the valves are open, atrioventricular valves are open. So what happens before the contraction in the 0.7 seconds interval, during this time there will be a flow of blood, the passive flow of blood without contraction. The Guyton mentions that there is 80% flow of the blood passively, and some other books that mention that there is actually a three-phase flow of blood from the atria to the ventricle. In the first flow, which is the passive flow, this will be a kind of rapid flow. In this, what will happen? From the 100%, the 70% of the blood will move in the first step. That will be called as a rapid flow or rapid filling of the ventricle. And in the second step, there will be a slow filling in which the 20% of the blood will move. And in the third step, the remaining 10% blood will move from the atria to the ventricle. And these three steps are quite matching with the time interval of the atria contraction and relaxation. Means 0.1 second is used to contract the blood from the atria to the ventricle. So the remaining 10% will be pumped from the atria to the ventricles by means of the atrial contraction, which will occur in 0.1 second. Like this, the blood will enter to the ventricle. The next step that will happen is that, so first of all, passive flow happened, then the atrial contraction happened. The passive flow was in three steps, remember. Then the atrial contraction happened. So this atrial contraction was the last third step of the pouring the blood from the atria to the ventricle. In the third step, what will happen? The isometric contraction will happen. Isometric contraction. What is isometric contraction? Iso means same, metric means measurement, and contraction, you know when it contracts. But here what will happen? As the blood moves from the atria to the ventricle, the ventricles will feel a kind of tension, and then it will create the pressure inside. So in the meanwhile, the ventricle will undergo in a kind of contraction in which the muscle fiber size will not decrease or increase. That will be static, and due to which this is given, this contraction is called as isometric, means same measurement of the muscle fibers. The length is not decreased, neither increased nor decreased. And this phase, the third step, is also called as the closed cavity step or the closed cavity contraction. Why? As the blood enters after the atrial contraction to the ventricles, then these valves, atrioventricular valves, will close. And the valve present here, semilunar valves in the arteries, pulmonary artery and systemic artery, aorta, they are also closed. They are closed since the beginning. So what happens now? A kind of closed cavity is produced. Now in this closed cavity, a kind of contraction is happening, which is called as isometric contraction, but the cavity is closed, and that's why this contraction is also called as closed cavity contraction. So when the cavity is closed and there is no kind of blood flow observed either into the ventricles or out from the ventricle. So that's why the volume of the blood present here will be the same, or will be equal for a short period of time, will not be changed. So that's why this is also called as, the isometric contraction step is also called as isovolumetric contraction, because the volume is same, means the volume is not changed. The reason is that because the cavity is closed and the volume of the blood is not pumped by the ventricles, neither received to the ventricles. Well, then what will happen in the fourth step? Isotonic contraction will happen. This is the step in which the blood will pump. Here, you know, isotonic means the whole muscles of the ventricles will come in the one tone. They will contract. After the contraction, the blood will be pumped because the pressure will increase here. And as you know, the game is totally of pressure. When the pressure is high in the atria, the blood will enter to the ventricles. When the pressure increases in the ventricle, then the blood will be pumped from the ventricles to the arteries, means towards the lungs and towards the whole body. By means of the right ventricle, the blood will be pumped from that ventricles to the lungs, from the left ventricles towards the whole body through the systemic artery, aorta. So like this, what will happen? These valves will open and the blood will be delivered. And to stop the back flow, these valves will close. Semilunar valves will close in order to avoid. Then in the fifth step, what will happen? Isometric relaxation will happen. Just like isometric contraction, isometric relaxation will happen. And in the sixth step, isotonic relaxation will happen. And as the heart moves or enters to the ventricular relaxation, the cycle is going to be complete. In the meanwhile, again, what will happen? again the cycle will repeat. There will be again the rapid flow of the blood from the atria to the ventricle, because the valve will open between the atria and ventricle. The tricuspid valve and the mitral valve will open to allow the blood after the isotonic relaxation. So now we will come towards our next point, that is about the sounds. During this atrial contraction, the ventricular contraction and ventricular relaxations, during this phase, these phases, the sounds are just heard. Generally, two sounds are focused more, but as you know, I discussed 2 to 3 books and I got 2 more sounds, that S1, S2, S3 and S4 now. So now I will tell you how the sounds are generated and what are the positions of their production. When the blood enters from the atria to the ventricle and the ventricular valve close after the atrial contraction, these valve will generate a sound, or they will produce a sound. The sound will be heard after the atrial ventricular valve closure here. That is given the name is sound 1 after the atrial contraction. The second sound after the ventricular contraction will be heard, which is actually of the closure of the semilunar valve. Which of the semilunar valve. That is actually the sound 2 here. And then we will hear the next sound, that is the sound 3 sound, third sound, which is actually due to the inflow of the 70% of the rapid passive flow of the blood from the atria to the ventricle. So when 70% of the blood is moving from the 100% of the atria to the ventricle, so it is quite enough big amount, large amount. So this large concentration will also cause a kind of sound when it is dropped or when the blood is poured to the ventricles. So that sound is given the name is sound 3. And sound 4 is called as the sound of the atrial contraction. When the atrial contracts, they will also generate or produce sound. That is given the name is sound 4. If you have any kind of question, you can comment that in the comment box. We'll come with the answers very soon, inshallah. Thank you for watching and thank you for giving us your precious time.